The federal government has introduced fresh preventive measures to combat the prevalence of malaria in Nigeria. The coordinator of the National Malaria Elimination Program, Dr. Godwin Intandom, disclosed this during the second biennial media chat held in Abuja. He said these initiatives highlight the government's commitment to tackling malaria and reducing its impact on public health in Nigeria. Let's join Elizabeth Kasham for more.
The rainy season approaching, Dr. Intandom announced the deployment of new preventive measures, particularly targeting school children who are identified as the most vulnerable to malaria. This initiative, he said, aims to pilot preventive treatment among this demography to curb the spread of the disease.
We also distribute nets, and most recently we have started seasonal malaria chemopreventive treatment, especially in the northern part of the country where malaria is very prevalent, and we've received very good commendation. And I must tell you, the mortality in that region has reduced as a result of the intervention, that is seasonal malaria chemoprevention. When you talk about seasonal malaria chemopreventive treatment, it talks about areas where rainfall is seasonal.
The head program manager of the National Malaria Elimination Program, Mr. Oyeleke Sunday, stressed the importance of synchronizing efforts to effectively reach a larger segment of the population across the country.
But we all know that malaria remains a very big body globally. Unfortunately, Nigeria is the one that has the highest body in the world. And whether it is conventional media, the traditional media, the social media or new media, as we are all aware, there is no doubt about the fact that our people must know how to fight malaria.
Furthermore, Dr. Olushola Adewoye, Senior Technical Advisor of Breakthrough Action Nigeria, emphasized the significance of accurate and factual reporting on malaria to educate the populace about treatment and prevention methods.
Go to the communities, find out. Today we're focusing on care seeking. Do people really go to the facilities? Where do they go? Why do they go there? What can we do? The factors that are underplaying the seeking of care by people in the communities. How do we make a difference as media personnel?
The World Health Organization malaria reports on Nigeria indicated a major public health concern with an estimated 68 million cases and 194,000 deaths due to the disease in 2021. According to the report, Nigeria has the highest burden of malaria globally, accounting for nearly 27% of the global malaria burden. Highlighting Nigeria's global leadership in malaria cases, the federal government had earlier announced its plans to reduce malaria to 10% prevalence in 2025. Elizabeth Kasham, ASO Television News.